Back to the first slide. Back. There, okay.
So I was telling the other students that are here in the classroom today that we are going to do this a little bit differently. Normally we do endocrine first, but because blood is so, there's so much information for it, and also I've warned the students that are here that it's heavily weighted on the exam. There's quite a few questions on your midterm for blood. So I'm going to try to concentrate on that first, and then after that we'll do the endocrine. So a little bit different order in your book. So we're talking about what are the components of the cardiovascular system first, and their major function. And this is 2 brief slides, and then we'll start with the blood. So your cardiovascular system is the transport, and of course, the reason we're talking about that is because the fluid media that is transporting is the blood. You have the arteries, capillaries, venules, and veins that are part of the transport system. Now, when we talk about the heart and we talk about the circulatory system, we'll be reviewing this again. So if you really don't want to write it all down, that's fine. But just the fluid medium is the blood. Okay. On to the next slide. So the transport materials that transports oxygen, your nutrients, our hormones, which we'll be talking about in the second part of this class, and immune system components, and it takes away all of the waste products from the cells. So your cardiovascular system has got a lot of responsibilities. I have to close the door, it's getting a little noisy. Oh, hi, Brenda. Hi, sorry. We started without you. Okay. Yeah, just started. We were having some technical difficulties getting everything organized. So it doesn't matter that you're a little bit late. Because yeah, I was like, oh no, this much at all. So the first part, we were just discussing the cardiovascular system, which we're going to be doing when I do the heart and the circulatory system. So this is just a quick review. Okay. And the most important part about this is that the cardiovascular system is just transport media for blood. So we're doing blood first. Okay? Yeah. So our people at home, I was just getting one of the students up to date. She came in a wee bit late. So what are the important components and major functions of the blood? That's what we're going to be discussing for the rest of this morning. So as it says here, the blood is a specialized fluid, connective tissue of the body. The proteins are in suspension, and later on we'll talk about what they're suspended in. And it says it contains cells suspended in a fluid matrix. I like that word, matrix. It keeps showing up in everything, like bone matrix. I'll let you take a few notes there. Now, for the people at home, I was telling my classes here that there's quite a variance in the PowerPoints that you're getting on your Google site and the PowerPoints that I've redone. I found a lot of the PowerPoints on the Google site were very detailed, kind of over detailed, a lot of information that isn't really necessary. So I've really tried to focus on giving you the information that you're going to need to do your job as nurses. So you'll find I'm talking to Peter, the fellow who does the tech for me, and we're going to try to post them on Moodle site with your Biology 12, and it'll just be listed as PowerPoint, and it'll be, I'll make some note there to say that it's been revised, so that you'll know that the PowerPoints have changed. And I think you'll find them really helpful to use those PowerPoints. Because like I say, the other ones, especially the endocrine, does not have a lot of detail. So I've put in lots more detail into the endocrine one. And the students that I have here, they kind of know, and I'm sure you guys have heard this before, that anything that you see when on the PowerPoints that's a little bit different in color, usually it's important, right? So I try to make a point of, like the fluid matrix is important because it's a different color, that type of thing. And also anything that's in a dark red, you probably will see on the exam. So when you look at your PowerPoints, it's going to help you with your exam. The other thing too is when I send you out the keyword studies, I've gone through the exams and looked at the questions. A lot of the keyword studies that I'm sending to you reflects the exam. So please have a look at your keyword studies when you're studying for the midterm. And for the final, I've done them kind of both together. So that'll help you with the midterm for sure. Yay! Yay! You're welcome. Thank you. I was talking to Danielle earlier before the class and telling her how difficult this course is. If you pass this, really you're working at an RN level and above. A lot of the information that are in that book that you've got in your textbook, plus the PowerPoints, are really at an RN level. So it's a hard course. It's not
you get it.
Yeah, you get it. If you pass, you get a real huge pat on the back. The other thing we're talking about is syllabus. You'll notice on the syllabus that you get awarded percentages for doing the end of the chapter reviews, 5%, which is 5% total. And you also get awarded percentage for each quiz, which is 5% each. So it's worth your while doing them because you could actually work it right. You could actually pass the course by doing all of your reviews, by class participation, which is 5% as well, and doing your Cornell system, which I've seen from a lot of students get on the online students, you'll get 5% for that too, or 20% for that. So really, do your work. The exams aren't as bad. Try to get all your other work done.
Today I work on it while I'm at the
Okay.
because they have online service there, so I can do that.
Oh, okay. So sorry, we'll carry on. I'm just kind of getting the online students up to speed for studying for the exam too. So the functions of the blood, it transports dissolved nutrients or dissolved substances. Oxygen is a big one, of course, and it moves away the waste products to the kidneys and to the liver. It regulates the acid base of the blood and of the body, and it transports electrolytes, which is your fluids that have sodium, potassium, and all the different electrolytes in it. So it's responsible for that too. I'll just let you break that down. So it's also responsible for defense. It carries white blood cells. And it defends against toxins in your system as well. So any toxins that enter your systems, whether they be, say, heavy metal toxins, they would move those toxins to the liver for detoxification. Toxins in form of medications as well. The liver is responsible for detoxifying anything like that, and the blood's responsible for delivering it to the liver. Stabilization of temperature. Of course, as soon as you are out in the cold, your peripheral vascular system will open to allow you to warm your arms and legs, right? So the blood also goes to your peripheral system, to your fingers and toes, to help keep them warm if it's cold outside. Also, the reverse of that is when it's hot, the peripheral vascular system kind of shuts down, and you don't have as much blood circulating. So it restricts fluid losses. So if you're ever in an accident and you have an injury, huge laceration, or huge cut on your arm, it's going to be responsible for forming the scab, for the clotting. That's going to protect you from losing too much fluid, too much blood. So I don't know why I put that in, just to scare people. So whole blood includes plasma, and that's the fluid that the blood cells are moving in, right? It's just the kind of transport medium. So the formed elements, you can see that's in red, are all the cells and the solids. The plasma itself. Now, when you see these percentages, I will tell you which one is important, right, that you have to know. There's only one that you really have to know. But this just gives you an idea of how much water is in plasma, because when you think about 92% is water, think of patients that get dehydrated. It's not uncommon, that's why they're confused, because 92% of that is just water. So it certainly, dehydration really affects the elderly, it affects everybody, but the elderly especially. So the smaller part is the plasma protein and other solutes that are in the plasma. So formed elements include the red blood cells. Erythrocytes, you're going to see that word fairly often in your practice. You see erythrocyte sedimentation rate, and they refer to the erythrocytes frequently in your practice. If you get blood results back from the lab, they will be listed as erythrocytes. So that's the word that it will be using in the future. They transport oxygen. We're going to talk further about how the red cells do that later on in the slide. The white blood cells, of course, the leukocytes are part of your immune system and part of your defense against infection. And the platelets, cell fragments involved in clotting. Now I have a photograph here in one of my textbooks that I'm going to hold up, and hopefully the people at home are going to be able to see it as well, because it just gives you a good picture of kind of what all these cells look like, magnified. And I'll hand it around to the class in a second too. And hopefully, I just have to turn my laptop so I can see, students at home can see it. such a challenge. It's like working in a mirror. And then it's delayed because the feed delays, so. I don't know. Okay, I think we made it. Good, awesome. Okay. So you can see the red cells that they look like kind of donuts. Those are the red cells. The other ones, the kind of cloudy looking, I'm going to grab the book here. These kind in here are the white cells. And they look kind of a grayish white color. And these little round yellow things, what we call the fragments, the platelet fragments that are in the bloodstream as well. So that's kind of what they look like. And I'm just going to show the class, the other class members, what they look like. Jelly filled donuts. Yeah, two bits of jelly. We're doing good. That's all we're my mind. It's all about food, right? Okay. So we've all kind of decided here that the red cells look kind of like donuts, and the white cells, they look like Timbits. Look at the whole. Like I was saying, I don't know if you heard me at home. It's all about food today. That's all. Yeah. So this is just a, picture of the components, and this is in your textbook as well. Now the percentage that I was telling you about, the only one that you really have to know is this one here. 55%. Plasma is 55% of total blood volume. So just put a big circle around that. That's really the only percentage that you're required to remember. 55% of total blood volume. And this just breaks it down to plasma and the white blood cells, this teeny little strip in here, and then the red blood cells make up the rest of the blood. Hemopoiesis is, again, another word that you're going to have to remember. And it's just the process of producing foreign elements within the bone marrow. Now we're back to the bone marrow again. You remember that the red bone marrow produces blood cells. So the myeloid stem cells develop into your red cells, and the lymphoid stem cells are your lymphocytes. And the lymphocytes are just one of your defense mechanisms against infection. So the little comment down here is just that leukemia is a disease of the bone marrow, which actually produces mutant white cells that are not able to do their job. So people with leukemia, of course, have a high rate of infection because they can't fight off it. You'll see a lot of elderly people with leukemia, and they often will die from a secondary infection like a pneumonia or like that type of thing. I'll just let you break that down. You don't have to really write down the leukemia part. Yeah, just the top part, because you'll be studying all this in your nursing classes. But it's just enough, gives you an idea of what. Oh, that's okay. I have one eye that's kind of blurry, and I was all worried about it. I thought, oh my God, my eye's blurry. Something's wrong. I went to clean my glasses. yesterday, and I was spraying a sealer on it because my roof is getting old. It really needs to be changed. It needs to be redone, but it's expensive, so I was just sealing. And I go, I guess that's what was on my glasses. I can't see it. Can't see. Okay, sorry. Moving around. Physical characteristics of whole blood. This is kind of interesting. It's at 38 degrees because normally your body temperature is 37. So this is like core temperature. Things are falling. That's okay. High viscosity, meaning it's thick, right? It's kind of a thick fluid. Now these pHs, you are not to be concerned about. Blood pHs is something that we would do in the emergency department to see how much carbon dioxide and how much oxygen is in the blood if someone has been in a severe accident. So I'm not really sure they were included. I thought I'd leave them there. But it's just to give you an idea that the blood is responsible for the pH. Blood volume. 7% of the whole body, you don't have to really know that number, but it's kind of interesting to know these numbers only because if you're transfusing, it gives you an idea of how much placed. If you transfuse 4 liters, you've replaced over half of the system, right? And that can really affect the person as far as antibodies and different problems. So, also temperature. When you transfuse that much, there's all sorts of other problems that you can run into. Have I transfused that much? Yeah, twice. So, unfortunately, sadly enough, the person didn't bleed out, and just kept putting the blood in, and it's just coming out as fast as that they had been in such a severe car accident. And sadly enough, we lost that person. That was sad. The husband actually was uninjured, and he had driven his car coming down the Highland Valley Upper Hill. He had passed one of the big concentrate trucks, and as he pulled in too soon, so the passenger side was hit by the concentrate truck. He was totally uninjured, and she was so badly injured that passed on. And that was a really sad situation because he felt so guilty. He was watching all this going on. So bad things happen. But thank God that there's people out there who donate blood. They have saved so many lives. Yeah, we're giving up on that. Poster keeps falling down here. Okay, plasma. Here again, I've highlighted this in red. So 55% of the blood volume is an extracellular fluid in the body. So meaning extracellular means it's in the blood vessel, it's floating around, doesn't go into the cells. So that's what they meant by extracellular. Okay. So it says plasma and that's a funny N, I know it's weird. And interstitial fluid. They continuously exchange certain substances across the capillary walls. So what they do exchange is water and ions and small solutes. So you guys know what capillaries are? Capillaries are where the smallest part of your circulatory system, and they intersect like that. They kind of got your red blood, your oxygenated blood coming in, and they intersect. So you have oxygenated on one side, and you have deoxygenated on the other. They've given up their oxygen to the cells. So those are capillaries. Okay? They're the tiniest, they're the tiniest part of the circulatory system, really teeny weeny, like cell size. That's what they're talking about. So it's almost like train pulling into a train station, like, lets up nutrients and then, takes away, different waste products and so forth. So there's classes of plasma proteins, albumins, globulins, and fibrinogen. So you can kind of remember by the ins part of it, albumins and globulins. The percentages again, you don't have to remember. It just gives you an idea of how much is involved. Fibrinogen is quite small. So it just gives you an idea of how much content there is. Okay. Albumins, are 60%, which is the largest part of plasma proteins. And they transport fatty acids and cholesterol. They transport thyroid hormones, which we're going to be talking about endocrine and thyroid in the next part of the class, the blood. So we'll be reviewing that again. And steroid hormones, which are your like your ovaries produce the estrogen and progesterone, and the testosterone is the male gonads, right? So the sex hormone. Globulins, that's the 35%. Antibodies, so they're important in the fact that they are helping you protect your body. And they're called immune, so the immune system. Easy to remember, immunoglobulins. So you can see here with the hormone, metal, lipid, and steroid, they're binding proteins. So in other words, they bind to the hormones or metals so that they can move them. So if there was some kind of heavy metals in your system, like I say, they can bind to the heavy metal and move them to the liver so they can be detoxified. Let's write that down. Just take a quick sugar. They only happen when I'm trying to do coffee. I don't want to do so good.
You're going to do it.
Yeah. Machine. Carry on. I'll play with the machine. Fibrinogen is the smallest portion of the plasma protein, and it is used in the clotting of our blood when you have an injury. So I don't know if you remember when we talked about the bone clotting. when we're talking about the skeletal system. And you have some handouts for that it is the same as the bone clotting. All clotting mechanisms are the same. So I'm not sure if you remember how that works. So the fibrinogen strands come in and make a mesh so they can catch the blood cells. And then later on it forms the yeah, right. And I did give you a handout for the bone. Which will go, there's a lot more information about this. Okay. Very good. I haven't taken it yet. I just got the machine to work. Okay. The serum. So plasma converts to serum after clotting has occurred. So in a blood sample, I don't know if you guys have ever seen blood samples from the lab, or when you've got, actually when you get blood taken, it doesn't clot. They have a chemical in there to prevent it from clotting if you go to just get a blood sample. But the plasma itself converts to serum after the clotting has occurred. And in a tube, you would see the clot at the bottom, and you would see this yellow fluid above, and that would be the serum. Write that down. Try to do it quietly, and everybody knows. The one good thing about today is that we talk about the endocrine system and talk all the time, so pretty up to date on it. Didn't have to study that one. Okay. So other plasma proteins, 1%, that's a little teeny weeny bit of the plasma, enzymes and hormones. In a way, it's kind of good for doing this backwards today, the blood first and then the endocrine, because they kind of fit together. Yeah, the hormones and the enzymes fit together a bit better. The origins of plasma proteins, 90% are made in the liver. And again, as a reminder, you don't have to know these percentages, but they just give you an idea of who's doing all the work. The other 10% are antibodies made by the lymphocytes and hormones made by the endocrine organs. Okay. Plasma expanders. Now, this is not something that you as an LPN would be involved in. You may end up going to get them for the nurses, the RNs, and the doctor, but you yourself would not be able to demonstrate them. They are just to buy you some time, or buy the nurses and the doctors some time before we can get their blood typed. And what it does, it increases the volume. So if the person's bleeding heavily, They will be losing a lot of red cells, and you want to replace the red cells with whole blood. But while you're waiting for them to laboratory to do all its work, you can give the plasma expanders to help maintain that volume. Oops, oh dear. Big jump. So this is just a list of the plasma expanders, and like I say, you would not be required to give them or monitor them. LPNs at this time run saline, and that's all they run. Or established saline, they can hang saline as well. But this is more of an emergency type situation. Normal saline is used, and that's your first line. When people come in, we usually start on normal saline right away. And then we start working on the other ones after that, depending on what their blood pressure is, how much blood they have lost. But that's just a list of the different ones that we use. We're going to talk about the red blood cells now, which are probably the most important part of the blood system. So, as I say, 99.9% of the blood's formed elements are red cells. And they are red, but unusual. And we'll talk about why they're red in a few minutes. Red color is, is given by hemoglobin. Let's write that down. Okay. Joseph's over there writing away. Okay.
I'm dealing with my dyslexia right at the same time.
Oh, letters should be back.
Yeah,
and everything.
right.
I have dyslexia with numbers. I have an awful time when I look at a number, I'll switch.
Yeah.
But it can be really bad sometimes, especially with phone numbers.
Yeah.
Switch to them. Okay, so pardon.
That's bad with numbers.
Yeah.
Since the cell phones come in,
I don't remember. I used to have hundreds of numbers. Okay, red blood cell count. So when they're reported, when you get your lab studies back, they will report the number of red blood cells in a microliter of whole blood. So these numbers again are not something you'll have to remember, because when you get your lab results back, they have the normal values written on the side. So you don't really have to memorize all these for your work site. The average lifespan of a red cell is less than about 120 days. This number is important. You're going to see that one again. So make note of that. I had to do a bit of reading with that one because in your textbook, it says less than 120 days. So if it's less than, what are you going to put on the exam, right? So what number are we going to use? But just remember this number here. That'll help you through. Your hemoglobin A1Cs, which are detect blood glucose over 3 months, are done in 90 days.
We should know the numbers for that.
So the hemoglobin A1C you will have to know, but that's later on in your nursing course, right? Yeah. Because diabetics have to get them done every 2 months. But the average lifespan is 120. Hematocrit, that is the concentration of the blood that consists of packed cells, meaning you took out the plasma and you took out the fluid. What you're left with is packed cells, the packed red cells. And so they're expressed in a percentage. So these, like I say, the information is important for you to kind of know, but the numbers aren't, because you can get all that information off of your lab reports when they come back. And they are highlighted them as high or low. The cause of increased hematocrit, meaning it's more concentrated. And dehydration is one of the big ones. It means you've lost your plasma. And you remember plasma is about 92% of water. It's just water. So you've lost that water content, so your hematocrit goes up. So I'll show you if a patient is dehydrated. And it shows you a little bit more about infections that they have as well. Polycythemia is a disease that you'll probably be talking about later in your nursing programs. And the blood marrow actually produces more red blood cells than it should. And we seem to have quite high number in our population in Ashcroft of polycythemics. And we do a lot of bloodletting. That's what it is, old-fashioned bloodletting. And we take off a portion of the blood to lower their hematocrit level. Because polycythemia can cause a lot of problems, especially high blood pressure. There's just too much volume. The body's doing too many. But this is another one that you're going to be taking in your nursing. So causes of decreased hematocrit. So if you're losing red blood cells through hemorrhage of any type, your hematocrit is going to drop. And that will tell the doctor, of course, that you are losing blood somewhere. If it's not visibly obvious, it could be internal. So this has a picture of a red blood cell, and I showed you those ones earlier. Red blood cells don't have any nucleus. They are just more like a soft, squishy inside to them, but there's no nucleus. They're not like a regular cell. And in that way, it means that the red blood cells don't regenerate themselves. They have to be made in the red bone marrow, but they do die in that 120 days period. The other thing too is they are like concave in the middle. This increases the surface area of an organ, and they are a liquid organ. Like in your brain, you have those folds in your brain, and that increases the surface area. So that allows them to carry more hemoglobin. So that's why they have that concave shape, or biconcave shape. There's skin on both sides. The other thing, it also allows them to move through the capillaries. Sometimes they have to go single file if the capillaries are very tiny. So it allows them a little bit of flexibility. And I just explained that already, the high surface volume. It allows them to carry more oxygen. And the discs, when they go through the narrow blood vessels, they can stack up like dinner plates to get through. And they can bend and flex when they go through the small capillaries. So the lifespan, again, is listed there, around 4 months, because they can't repair themselves. They don't have a nuclei, they can't generate themselves.
Would you ever use 4 months instead of 120 days to treat this?
No. They're both there. They're both listed. They got a little thing in the back. But a good question. Okay? So the structure and function of hemoglobin. Now hemoglobin is a protein molecule that transports oxygen, respiratory gases. Now when you go to the lab and you're just checking to see what your hemoglobin is, these values, the 160 and 120 are American values. We're to 12, 16 are our values, okay, in Canada. So there's a bit of a difference. You won't be required to know that. But when, like I said, when you look at your lab values, they're going to be not in hundreds, they'll just be in double digits, not triple. So I'm going to show you a picture of a hemoglobin molecule. So hopefully you can get this on the camera. Right here, if you can see this, is the hemoglobin molecule. Okay. It also includes an atom of iron, and iron is important to remember. The bluish color is no oxygen in it right now. The reddish color has been oxygenated, and it's the iron that helps the hemoglobin molecule oxygenate itself. So I'll just show you guys. Right here. That's why when you have, I'll get back to the microphone so they can hear me. So that's when, I don't know if you've been able to notice, when you cut yourself, it's not a good example. When we have patients that are bleeding, and they're bleeding out bright red blood, so that's kind of a fresher blood because it's got more oxygen in it. Or if they're bleeding a dark red, it's coming from the veins, it's not as oxygenated. And it is a different color. Your oxygenated blood is a kind of a really bright kind of orangey red, and your deoxygenated blood that's already given up its oxygen, kind of a bluey red. So you get to know the difference. Your oxygenated blood is in your arteries, right, coming from the heart. Deoxygenated is in your veins, and that's why the veins in your arms are quite bluey colored, because the oxygen has been given up to the cells. The iron's involved, and the iron is very important because people who suffer from anemia usually don't have a lot of iron in their diet, or they may have been bleeding slowly, like women who have had a baby and they've lost quite a bit of blood. The iron part of their blood is low. And that can all be done in the lab, and they can tell you exactly how much iron and how much blood is involved. So if we were trying to increase the hema in the blood, we would give people iron. We either give them iron injections, or we can actually give it IV as well, or they can take it orally. So that helps raise the hema in the blood. And And right down here too, ions easily bind to oxygen. So they bind to the oxygen and carry it on the red cell. Talking now about oxygen transport, the iron and hemoglobin forms an unstable reversible bond. And the reason it's good that it's unstable and it's reversible is that they can give up the oxygen to the cells. If it was stable, then the red cell wouldn't give the oxygen to the cells. So unstable and irreversible is good. Now oxygen-loaded form, meaning when the red cell has gathered its oxygen from the lungs, it's called oxyhemoglobin, and it is bright red. And when it's unloaded its oxygen to the cells, it is deoxyhemoglobin. And it's kind of easy to see. Remember this, it's deoxygenated, so they've got the D in front of that word. And it is a purpley green color because it's lost its oxygen. Oh gosh, I can think so fast.
I know.
Wow.
It's very fast movies.
Mm-hmm.
I thought when I first started, like, oh my god, it's gonna be one of the best. But I can't really go by so fast.
There's so much information about this too. I like this stuff. I like teaching it because there's lots of information. The classes I don't like are the ethical. Are we good with this one? Yeah, okay. Anemia. Well, we talked about anemia a little bit when I talked about bleeding, right? So the hematocrit or hemoglobin levels are below normal. And it's caused by lots of different conditions. It can be caused by bleeding. Women who have very heavy periods, postpartum when they've delivered their babies, and they've lost a lot of blood. It can also be caused from dietary problems, like not getting enough iron in your diet. Also, pernicious anemia is lack of B12, and you have to give the B12 so that the body can actually absorb iron. I think it's in here a little later. Okay. Probably women are more prone to anemias because of the fact that we do have menstrual cycles each month and have babies. Just talk about how the components of old or damaged red blood cells have been cycled. So macrophages of the liver, spleen, and bone marrow monitor red blood cells to detect early signs of damage. Then they destroy them. So phagocytosis is a word you'll see again in your nursing studies, which means they just wrap themselves around the old damaged cell and they actually dissolve them. My body is your body talking, what is that talking to? Okay. Red blood cells and hemoglobin. So So when the red blood cells are engulfed and destroyed, the iron is converted to bilirubin. Now that's what you see with babies that are jaundiced. When babies are born, they have a high concentration of hemoglobin from the mom. So as the baby body gets rid of this extra high concentration of red cells, it breaks down the red cells. The phagocytes come in and break them down. There's too many. But it releases bilirubin in this process. So the bilirubin actually tints the skin yellow. And that's why you get jaundice babies. There's lots of other things that could cause this as well. Tumors of the liver, that type of thing. The liver is involved in bilirubin. It's excreted as bile. Okay. So bile is a bright green color. And then actually the reason feces or stools are browny colors is from the bile itself. Changes that stool to a browny color. If there's something wrong with the liver and the bile, oftentimes the stools will just be white. So we might see that in your career, that a patient will have a white colored stool. Then you'll know that there's a problem. Sorry. The gallbladder may have stones in it. There may be some problems that's not within the body. So jaundice, we talked a little bit about that. The bile ducts are blocked by a tumor, or the liver can't absorb or excrete the bilirubin, such as in cirrhosis of the liver. Cirrhosis can be caused from alcohol consumption. It can be caused from different other diseases, also from damage due to taking too many Tylenol and that type of thing. It's actually poisoning. So cirrhosis has lots of causes. And the other one too is common. When you get your hepatitis A, B, C, D, E, F, G, H, I, J. There's a lot of them. We always talk about hepatitis A, B, but there's a whole bunch more after that. So hepatitis can also cause this yellowing because it's damaging the liver. Okay. Even hemoglobinuria. Hemoglobin breaks down products in the urine due to excess hemolysis in the urine. So that the urine can be dark brown colored or red colored. You will see those in disease processes. This is not normal. Your urine should be like diluted apple juice color. I remember my son, he was, I don't think he was older, like he was about 19 or 20. Flying into the house, he'd been talking to his brother, and he goes, Mom, what color is your pea supposed to be? Why are you asking me this question? Says you take a half a glass of apple juice and you put a half a glass of water in it, that's the color it's supposed to be. I don't know, he used to ask me some very weird questions. Anyway. Hematuria. Hema again, blood, right, in urine, right? So that can be, hematuria can be caused from bladder infections. You'll have blood in urine. They can be caused from stones in the kidney. So the stones are actually scraping down the ureters and they're causing the ureters to bleed, and then you'll get blood in the urine. And any sort of, actually, we had a fellow who we actually sent into Gallops who was in motorcycle riding, and he got thrown off his motorcycle. And he came in, and he was fine. He was a young, healthy 24-year-old. He maintained his blood pressure and his vital signs extremely well. But, you know, after doing this for 4 years, kept looking at him like, there's something wrong with this person, right? He was just a funny color, just an ugly color, right? Kept saying to the doc, no, something's wrong, something's wrong. The doc kept saying to me, no, his vital signs are great, it's not something's wrong. So as it turned out, he voided for us, and his urine was full of blood, like just frank blood. He had lacerated kidney in 2 places. So trauma can cause blood in urine as well. So a few guys get to work emerged, and anybody coming in with trauma of any sort, for motorcycle accidents or car accidents or whatever, always get a urine sample because there could be kidney damage. It'll show up as red cells in the urine. Erythropoiesis, urethra again, red cell. Word again.
It's become blurry.
Okay. We had this problem last time, didn't we? Yeah. Why? I need my tech again. And this is a new camera. Is that better? I'm adjusting
Yeah,
the
it is.
camera. Oh, good. Thank you. I don't know why it does that. It just gets tired. It's just about break time. Maybe that's what's wrong. Yeah. Anyway, so erythropoiesis is red cell formation. It occurs in the red bone marrow, which you guys already know all about that, or myeloid tissue. So stem cells mature into and become red blood cells. Hemocytoblasts. Now, we're back into the blasts in the class that we had in bone, right? In the skeletal system. So it's just the same. Remember the B in blast is always building, right? It means building, you're building something. So the stem cells in the bone marrow, they divide to produce myeloid stem cells, which then become red blood cells, and some of them white blood cells. Also, lymphoid stem cells are there, and they become lymphocytes. So they're involved in your immune system. And this has just been simplified. This is just a note to say there's more stages of development, but I simplified it down. There's a lot. So I'll let you write those down. Okay. The components building red blood cells requires amino acids and iron, vitamin B12, B6, and folic acid. These are really important because as Danielle and I were kind of talking about the B12, because you have to have B12 injections if you're not absorbing B12 properly to allow you to absorb iron. So oftentimes, especially in long-term care units, you will be giving B12 shots. And it's usually once a month you give them. B12 shots. You love detail?
Oh,
They make you feel good.
Oh, yeah.
They really give you a zap. Aw. Do you have pernicious anemia? Or you just
I just
need
have,
it?
yeah, I low iron.
Yeah. They being caught it really early in you.
Yeah, I was just really like phased out all the time, and then we did my blood, and I had an iron level of 4.
Oh,
Yeah.
that's really, really low.
Yeah.
So they offer transfusion?
No.
Because that's low enough.
They started giving me the pills right away.
Yeah.
And then they gave me the And it's weird because I eat a lot of like beef and broccoli and
All the good stuff.
yeah, but
Your meats are where you get most of this, the B12 and B6 and folic acid is in meat. So, but it's just that your body isn't absorbing it properly, and then it can't use it in iron, with the iron. But I'm glad it works. But do you find that at the end of the month, before you get your shot, you're getting really tired and kind of run down? Yeah. That's interesting, because you're very young to have it. Okay. Oh, pernicious anemia, we just talked about that. Okay. Low red blood cell production and not enough B12 in your system to help you absorb the iron. Now, that clock is really slow. You know that? I think it's not really working at all. Because it's been like 5 for the last 15 minutes. Okay. So what we're going to do is we'll probably start with this when we come back. And we'll take our break now. So anybody at home, it's break time. So 20 minutes from now. So I've got 2 o'clock exactly.
Yeah.
So 20 after 2, we'll come back. Okay. There.
that test that you're talking about, is that the 0 to 4.4, 4.5 to 7? Or is that the diabetic test that you have to get every 3 months? Or is
Oh,
that
yeah.
the wider range one?
That is
Or is that the 0 to 6?
now. Is that from today or is that?
I'm just trying to remember the lab results.
Oh, that for diabetes.
Yeah, like that H1.
Oh yeah. Hemoglobin A1C. Yeah. Hemoglobin A1C should be within 6. 6 is your
0, okay, so that's 0 to 6. 0.1 to 10 and then 10 to 22.
It's gonna be that is, I'm not sure which we're talking about.
We learned about that.
Your hemoglobin A1C should be for diabetic. Our goal is 6.
Okay.
Anything higher than that, because it only goes up to, well, it can go up fairly high. It can go 1.8. But it's a very narrow band. Because 6 to 1.8 is not a big wide range. So I'm not really sure what that is.
Because we had to learn 2, so we learned this one, and then there was a 0 to 6, 6 to 10, and then a 10 to 22.
Because your goal for your blood sugars should be 5 to 10. That's what diabetic is trying to keep their blood sugars at. Now yourself, because you are diabetic and you have insulin that's always being produced on demand when it's needed, your blood sugar probably right now, before after you eat, whenever, is around 5 to 6. And it should be. My boys, I test them all the time because I'm afraid they're going to get diabetes. Yeah. They're always 5. Like we have a great big Christmas dinner, check their blood sugars, they're 5. They eat whatever, candy, they're always 5. So that's the range that the average person sits at. Now, if you're doing a blood test, you're going in to see if you have diabetes. They're looking for a range from 3 3 to 6 is fasting. So if you fast for 12 hours, if you get a 3 or a 6, you're not a diabetic. If now they've lowered it to 7, but if it's 7, they'll start looking at you thinking maybe you are diabetic or you're becoming diabetic. So anything above 6, fasting, we're talking about fasting, is going to be looked at by a doctor to see if you are becoming diabetic. But I'm not really sure what those were.
To look at my pharmacology.
Yeah, I really don't.
Was that pharmacology? Do you remember learning that?
Yeah.
Do you remember what she taught us? No.
That's okay. No, and I'm thinking, you know, you guys are getting so much information in all your classes right now.
Directions.
It's very difficult to remember. So we'll probably come back a little bit. Oh, no problem. No rush. I think that's got to be the accident that come in right away. Or was the accident? You're all down. I think they're out. They run like flash right into the hospital. Yeah, I always hear those sirens. I think somebody's not having a good day. I'm having a better day. It's sad. It is. It actually is. And then the girls and the nerds joke around and say, "Oh, it's the South Job Security." Yeah, there's some stuff really. Works. Yeah, they do. After a while, I think that's
Where you have to have to be in there.
survival. Yeah.
And
And then you can't do your job because you're so busy feeling sad.
yeah, exactly.
Yeah, it is.
I think she went to the bathroom. Hello.
Having fun?
Oh, yes, loads of it. Loads of fun. You guys going to the pub or no? No. My daughter's ready for business.
I just finished a modality version.
Yes. Hi.
Oh, wow.
River.
That's
Hi, River. How are you?
I love your hair.
Beautiful blonde hair.
Yes.
Oh, I don't blame you. I like blonde hair too.
That's nice.
I'm in place that you Where my house is so cool. I find it open here.
I get it, so radio.
Anyways, we're gonna just go and have our lunch, so be back later. So, oh man.
There's 4 there, they're all disease, really basic class in class. I don't want to go over the money
Oh yeah. What's it for?
The print on front and the story on the back and whatever else you did, right? It's like,
Oh, wait.
it's really good.
Frame it and do it together.
Well, for dad, saying again, all of them. He's got guardian placements. He's got oval placements with little guardian. Yeah. Okay, so here's where there's a lot there, $2 each. Red, green, and then on this one.
$94 science for this one. Yeah, take her to the you guys can get something or yeah. She don't even have that. Okay. See you later, okay? Love you.
I gave mommy a hug and a kiss. I live there with more.
See ya.
Hate it when you get in here and you're like, "Is my car?"
Exactly.
Oh, good range.
Awesome.
You beat too? You beat too?
Yeah. I don't have the patience for it, but I still do.
Really?
Yeah.
Yeah. I was pretty good at teaching. Did you teach them or?
No, he's
Really? Oh. That's cool. If I had the time, I would. I have no time. Like, trying to make time because my daughter wants to go for princess and it's like making time last night. I drove down there. I didn't know about 1 o'clock this morning. And I was like, like really?
Yeah, we did. I wanted to go down there, but I'm a little time and stuff.
Yeah.
And the elder just passed away this morning, so I don't know if it would be a good idea coming
Mm-hmm.
down after. Because everybody would be in morning and stuff.
Yeah. Over there?
Yeah.
Really? You know what?
Yeah. Like some kind of.
Mm-hmm. That's my daughter's first time running for princess. So lots of kids here in town.
Oh, yeah.
And so, well, even she sold some of it. It was pretty quiet there last week.
Yeah, it looked like a sauce.
Mm-hmm. I just sent out text and Facebook posted it and ended up getting people buying.
Oh, yeah.
A lot of my family buying tickets.
Oh, yeah.
Yeah.
And everyone's in the skeleton.
Yeah. Yeah, it's a good idea because I'm really feels it.
Yeah. And it was hard.
Mm-hmm.
Whole pregnancy, like all the losses that I had, like,
Yeah.
it's crazy. That one, I lost three teenagers.
Mm-hmm. Yeah, didn't they were in the program here. In the BC APTA program with my brother. We got it around here. That was Jason. Used to be a lot of that. One of the elders passed away yesterday. Well, I don't know if he's doing it. You know the 71. It's like the neighbors that are drinking lots. Them, one of them passed away yesterday. You know him. Sandy Isaac. He's up about those. Well, they call them Sandy Bakes. He had cirrhosis in the liver.
How long was he there for?
I don't think very long.
Because he wasn't there on Thursday.
What's today, Friday?
Saturday. Was he in the hospital and then sent down?
I think he was at Hope and then I think he got some. But he wasn't, like, I think he was in his 40s or 50s or something, but he was one of the 74 guys. Yeah,
Which one?
that's what I said, Sandy Bates. That's the only thing I know was,
But what did he look like?
I don't know what he looked like now, because I haven't seen him since last year.
He wasn't the cute one that always was like, just don't call me late for dinner.
Probably.
Is that him?
Native guy? Yeah. Very nice toy.
That's like, I think they call her Sinbad. Do you know what I'm talking about? And she's still alive.
Wow. I don't know.
One day I found her, she was passed out in the alley, and that poor woman had bruises everywhere. Like somebody had taken a shit. And it was so sad, and I just was like, I'm gonna call the ambulance. You can't call the ambulance because the cops are just gonna pick me up and put me in the drug tank. I was like, I promise you, the cops are not. So I called the ambulance and I like explained the situation. The cops came.
No way.
I was so mad, and I just promised her that the cops were not coming, and they came.
Oh. It's so common because they have so much discrimination already, right?
Mm-hmm.
And then they don't want to go. It's like, no, this is going to happen to me. And
After watching that show yesterday, I felt so sad how, like, the medical system failed, like, that one lady. Remember how she had pneumonia? She was, like, freaking looked like she was dying. And they're like, no, you're just here for our dope. Like,
yeah.
get out of here.
Oh, yeah.
I'm like, she had pneumonia. She's going to die. And because she's a crackhead, she doesn't deserve the same treatment as anybody else. Like,
Exactly. Like, they're still human beings regardless of what they have.
Yeah.
These are their addiction. They're still people.
mm-hmm. What pisses me off about addiction is, like, having addiction is the same thing as having cancer. It's no different. It's a disease, you know? But a lot of people, like that. I can't stand that. I was kind of watching her this time when I was watching that video yesterday, just like,
I love that because she has that discrimination. Oh, she's such a judgment.
and then it was funny, because remember the day she called me culturally insensitive for wearing my math box?
That was stupid.
I know.
I was like, are you kidding me?
So then the next day, she's like, so I talked to my mom, and apparently my dad, grandpa was tomahawk, and she's going on and on and on. And I was like, wow, you might have made it in you, but you're still an asshole. And you probably should wear mud box if you've been culturally insensitive.
Yeah.
And then I was like, well, if you're tomahawk, Choshkava then. And she's like, what?
He's so anal that way.
Ugh. That was the dumbest thing I've ever heard in my life.
When you said that, I didn't hear the whole conversation, so I was joking with you. I was like, oh, yes, totally. Like, if anything, I think it's a compliment, right?
Yeah.
Like, to me, it's like a compliment, right? Like, when you see neighbors, when you see different nationalities wearing it, it's almost like you're like, yay, they actually think they're really, really, and they are proud of them. And that's my assumption, and that, to me, is everybody else's assumption. That's why you hear them. But then I get people when you were saying that, and I kind of didn't hear the whole conversation. So I'm like, oh, yeah, ha, 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 right? Because I was joking with her. I'm like, oh, yeah, you're so culturally insensitive. You know, like joking with her. But she knew I was joking. It came across with this a different way. Like, I have no problem. I think it's beautiful. Just such an idiot. He seems to be very racist.
Oh, yeah.
Mm-hmm.
And judgmental.
Mm-hmm.
Totally. I would hate to be a drug addict and then have to deal with her as a nurse.
I could see her like picking me out.
Oh, yeah.
If you're like went in there, like not me in general, but saying if you went in there and you were shaking, she'd be like, no, you need to go to the cops, or I'm calling the cops.
You should have heard her going off for one day about like antidepressants and how people shouldn't have to depend on drugs because they think that they're sad. And I was like, you do know that I take an antidepressant every day, right? And I was like, it's not because I'm sad. It's because I have a hormonal imbalance that makes me anxious all the time. I was like, and you know what? If you want to deal with people I'm not that way to then I'll walk with them. You can see
Yeah, she's seen mine too, and they're in the, when she's doing her study group. And she's like, I don't have any medications, and I pulled mine out, because I don't think anything of it, right? Like, I'm not fighting or anything, because I suffer from depression and anxiety, right? So they will combine, like, really bad anxiety. So I pulled them out, and she's like, oh, and it just started reading, and she's like, oh, I know what those are. But of course you do. And I just looked at her like, because I didn't think anything of it, right? To me, it's, it's my way of dealing with, like, the doctor's way of helping me deal with life and balancing them out so that I'm not, like, out of whack and everything's all messed up. It's like you said, when you're off it, you're like, everything anybody says to you, you like end up bawling. Yeah. Or you're like, oh my God, like you could forget something and see it because you can't cope with it.
My anxiety, and I don't know why, like, I think it's because I'm so controlling, but when I get really bad, like, anxiety attacks, I convince myself that I'm dying of a disease. And I'm like, I'm such a crazy person. I'm not. I'm hormonally imbalanced, but yeah.
Well, people have their own assumptions of what it is when they really don't know what it is. Like they're making their assumptions. Oh yeah, you're depending on the you're just using it as an addiction. And I'm like, you know nothing about what I have or anybody else, and it's starting to come out more and more that people suffer from it, and it balances them out. When other people are like, oh well, it's just an excuse and using it so you can take those. And like, you need more education before you sit there judging. And I was really sad remembering like when most people didn't pass the math. I got so happy inside. A little part of me just made my day. Yeah. Everyone else I was really sad for, but not her. Yeah. And then I thought she passed it.
That was hilarious.
That's awesome.
She's so like, I'm so sorry.
I think every class has one. Or he was pretty quiet. There's kind of great order on it. She was super, super quiet in her posture. Everything about her, like she was so distant. Like when you're super chattered, but when she's not, then it's like there's something like. I was asking her, "Are you okay?" She's like, "Yeah, I'm fine." But the way she was being, like I know we all appreciated that she was quiet, but it was a worry about what's behind that. What's going on in your life and why are you so quiet? Yeah. She's so distant, right?
Did her fiance not break up?
I don't know what's going on. Like, I don't think so, but I'm not sure what's going on. But Jose was saying is that he seems to abuse her because she's so kind. And in their, like, what you're saying, in their culture, the males are more dominant than the females. So, in her hierarchy, he's higher than her. So then she pulls herself down and says, I'm a dumb one, I'm stupid, I'm going to be alone for the rest of my life. Maybe that's what I need to do. That was the kind of mentality he gave her without him, she had nothing. This is kind of what the thing was going on.
It was so sad to listen to her too after like that math exam. She came up and she said, "What did you pass?" And I was like, "Oh, so I'm the only stupid one in the class." And it's like, you're not stupid for failing. Like that was a hard math exam. And like I spent a whole month of August just doing math. Like that's the only reason why I got that.
Yeah.
Like I was like, you're not stupid, and don't call yourself stupid. Because then it doesn't reflect nicely on anyone else who just passes and you're stupid.
She was like Glenna when she was like, I don't need a costume. I'm hideous with it, you know. I'm like, you are not here. I'm not taking a picture with her on Halloween. She's like, oh, no, I don't have a costume. Or then she goes, no, I don't need one. It's a hideous. I'm like, oh, don't say that. You're beautiful. Like, I really need it.
I know.
And it's sad because her heart is so big. Like, it is so big. And just amazing person to have her.
I'm so sad she's not going to be our teacher next semester.
Yeah,
It breaks my heart.
she's great. I love her.
There's one that I'd like to get rid of, and I keep going.
Yeah. Our life is going down pretty hard nowadays. What does it mean?
She's kind of making me mad how she's like, oh, well, I'll come in on professional practice day and do classwork with you, and then on Friday afternoon tutor session. Like, are you kidding me?
I was talking to Lori and I was like, I didn't tell because I wanted to finish my papers.
Had she not slept in for 45 minutes that day,
Yeah.
we could have been done all of that stuff.
Yeah, exactly.
Like, no.
So I was like, did you go or no? I didn't.
I had to work yesterday.
I went and did all my paperwork on my dementia and started my. I think I'm halfway through my interview thing, but there's so much information. Like,
I haven't even looked at it yet.
the questions, I think the questions are like 2 pages long, and there's like 7, 8, 9 questions per thing. So what I did was just put the question down, answer, question, answer, question, answer, and kind of just follow that layout. But there's so much in it, like I'm only not even halfway done, and then you have to do another commentary where you have like 5 little papers and you have to fill that in. But it just seems like so much work. Like you can go in there and the questions that they're asking, my grandma was like, what? Like, why should I have answered that? Like, what color is my hair? And then she was like, mortified, right? It was like, she goes, I don't look at my pee all the time. I don't know, yellow, and, you know, and I kind of, like, but I wrote it down.
Is that for the health promotion?
I think so. Okay. Professional communications, yeah, health promotion, yeah.
And then the pro-con that's due on Monday. Did you get a dementia handout?
Yep.
Because none of us can find it.
It's in the, it was in the, what do you call it? The beginning, where all the layout and all our people were doing.
Like the
Student guide, yeah, the student guide is all in there as far as online. I think it's like page 19 or 20. But it has the exact layout. I don't like it. I did it last night.
But there's a question on there that's referring to your handout of dementia. What stage do you think your patients is at?
I didn't even use that. I just.
Yes, because none of us got that handout.
No, I didn't get that. I just went online and looked at the stages, and mine was main stage, and it was like, how could you not put? I kept putting the time, and then they want to reference. You can't reference somebody. You can't disclose their name. You can't do that because you can't, and you can't even disclose. Because when I was in there, I was just never gonna go. Like, I didn't go look her up because I knew I was gonna do her. And like, you know, 2 years down the road, I didn't know I was gonna like use her on my papers. I don't know how good she is. Like 2 years later.
My resident that I used, that I interviewed, she died last year. So
The lady I did was in one of the, when I was a student, she was, she used to be a dog trainer. She had all kinds of beautiful dogs. She had these gorgeous dogs and everything. But she was in the late stages. She didn't know how to go to the doctor. Nothing. She didn't remember anything. She asked for her mom. She's like, I need my mommy. I want to get that. That was her biggest thing. So she would break down her child.
Oh, the residents that I interviewed, she thought she was probably like 19 or 20 because she's always sits by the window and looks for the ship for her husband to come home. Oh, every single day, but like she has no deficits except that.
Yeah.
And like every day she does her hair the same, wears the same outfit every day. Like, she's stuck in that one day.
We had a gentleman in Summerland Seniors Village who was causing a problem with the young nurses, right? He was being abused. So we kind of all sat down, the students, we kind of sat down and said, well, what if he had digressed, what age is he? And he was a very, and we were looking at his pictures and stuff, he was a very young, handsome man. And he was in the military during the war. And so in the uniform and everything. And really, he was living his teenage years. And, he chased some girls and all that stuff. And he didn't see himself as an older man. And he should be, dragging them on the rear end and think about that. So yeah, it's really sad.
Yeah.
But I think the hardest thing that I've seen is women when they get to when the childbearing years, when they have young children and they can't find their children.
Yeah.
You know, they are just desperate.
Or can't find their moms.
Yeah, and it's
I find that's a lot common, they can't find their moms. My mom's going
Yeah.
shopping, like, help me find my mom.
Right.
And that with a lot of ladies, is like, where's my mom? My mom's gonna leave me, I don't want her mad at me. And they're so devastated because in their mind, they're in that exact moment. And they're in the tears and, you know, like they're ready to cry because in their minds, they're like 4 or 5 years old and they're lost in their by themselves.
Great. And you think if you place yourself in that situation, and I think if I thought I'd lost my children, I would be just frantic. I would be, where are they? Where are they? If you go back to when they're like 2 and 3 years old, they're not even in school. So you can't make the excuse to the resident, oh, well, they're just at school, they'll be home on the bus soon, that type of thing.
Yeah.
I don't know, hopefully I don't have to go through that, but yeah, I'm devastated.
It's terrible.
How I'm going to manage it. I hope I have some really good nurses.
My daughter, she was mad at us one time because she wanted to sleep and she had walked away and I couldn't find her. And I was at a home park and you know there's a lot of different people coming in and camping there.
Yeah.
And she's probably about 10 years old and I tell you, I lived right now.
Yeah.
I was like her cousins and all of us were like looking for her. We couldn't find her. We went to the playgrounds and we were like everywhere we couldn't find her. And I was like, when she got back, I was like, this is not cool. I said, you can get mad at me. You can go sit in the car. At least I know you're in there and you're safe.
Yeah.
Or you can sit by me and be mad at me, but just don't take off like that because the thought of losing you is worse than, you know,
Whatever the problem was in the first place.
Yeah. And I said, I'd rather have you right beside me and be mad at me opposed to like way over there.
Right.
And even
I think in society these days, I mean, there's so many pedophiles and people that are harming children. I mean, it's just terrifying. And I used to worry about my granddaughter who's living in a subdivision. You know, this cute little place, she's only 3 years old, and she walks back and forth across the road to the babysitter. The babysitter's right across the road. During that time period, she's all alone. Like her mom watches her or something, but still, it's that time where she. Yeah, I'd be just frantic. Even my granddaughter now.
Yeah. There's this little girl, every morning when I'm driving my daughter to school, there's a building that's right by the trailer park.
Yeah.
She's standing there by herself, there's like, in this empty, big empty lot.
Right.
She's waiting for the bus, but I'm just like, how could you let a little she's maybe about 4 or 5 years old, and she's standing there by herself, like, anything that happens, and you go by and bang, she's gone. But it's like, how could you let your little girl like that be there by themselves?
And especially nowadays, there's so much information out there, and there's so much media that talk about it all the time, and Amber Alerts. You think that was parents think about it.
Yeah. To me, I'm like, oh my God, and my daughter's turning 15, and I still, like,
Yeah,
she
you
knows
still
I still want to know
Yeah.
where she is, like, you can let me know you're safe, even if it's just down the block. It's like,
Sure.
let me know you made it. And just
Yeah.
Like, you're acting weird. I'm like, no, I'm not.
No, you know, and that stays with them, and it's really funny. It'll come back to haunt you.
Yeah.
My son, I always used to make them if they were going somewhere, like far, like to Calgary or whatever. I would say, call me when you get there, so I know they're safe. Now, when I come back and I'm driving, I get to the house, and if I don't phone them within an hour or so, I get a phone call. You were supposed to phone me, Mom, when you got there. So yeah, it'll come back to haunt you, but it's a good thing, not a bad thing.
I did ask my mom.
Yeah. Well, it's because we love our families. You know, there's no other reason. So it's a good thing.
I apologized to my mom and realized how much. I was out for 2 weeks, and I was 13. I never told her nothing. I was like, I don't even know how much anxiety I put her through it. That's how I was all about these.
Right. Yeah. Anyway, so I guess we better get back on track here. So stimulating hormones. Erythropoietin is released by the kidneys, also called erythropoiesis, red blood cell formation, a stimulating hormone. I was kind of surprised it was released by the kidneys because I had just done all the endocrine stuff, And I'm thinking, well, how come it's not released by the hypothalamus or something by the kidneys? I'm not sure, but it is released by the kidneys. So it's secreted when the oxygen in the peripheral tissues is low, hypoxia. You'll see that word a lot. And it can be due, the hypoxia can be due to disease, like chronic obstructive lung disease, COPD, asthma, any of those type of diseases where the lungs are being damaged or they're not able to breathe properly, or high altitude. So if you grow up in a high altitude where the oxygen level actually is lower, your body adjusts to it and it creates more red blood. So people who are living in the Andes and high altitudes in Peru have a lot higher number of red blood cells than we do living down here. Kind of it. So that's why when you go hiking up in the mountains and you're high up, you're a little bit slower, maybe even a little bit dizzy, because you're not accustomed, you don't have enough red blood cells to carry the oxygen around at that altitude. It's just jumping all over the place. I wasn't even holding it very hard. Okay, what is blood typing and why is it important? And we all know that the surface antigens, proteins on the membrane surface that identify cells to the immune system. You'll get antigens with allergies, right? So you'll see antigens with B. But these ones are specific on the red blood cells. So if it's okay, the surface antigen says it's safe. Of course, there's no danger, therefore they're left alone. If it's not okay, it must be dangerous and destroyed. We're going to go on, because this is the ABO and the RH factors. What we're going to be talking about now. So first you kind of have to get the idea that there is a surface antigen on the red cell. Okay. Good. So we're going to be, like I said, talking about blood types, and they're determined by your genetics. So I am A positive, and I think both my sons are A positive. So they carry that. You don't know what you are? Moms will know what they are, because you have to know whether you're positive or RH. So do you know if you're RH positive? Oh, positive. Awesome. That's kind of like going. Okay, good. And we're going to be talking about RH negative and RH positive in a little while, and about babies too. Okay. So there are red blood cell surface antigens of AB or the RH, which is after the break. Okay. So the basic four types are A and B, AB and O. And then the secondary part of the typing is the RH factor, whether it's positive or negative. So there's kind of like two things you have to be thinking about. The RH factor came from rhesus monkeys, so that's why it's RH, because the rhesus monkeys is what they studied to understand AB and O's, like what type of blood. Now the percentages, again, you do not need to know, but it's just interesting to know how many people are in the A category, because I'm an A, so there's 40% of the population. So you're getting down to the ABs, which are only 4%. That's very, very minimal. But it's kind of lucky because these ABs can be transfused with anything. So that's good, because if there was only 4% and you were trying to transfuse, you had to have a match, it would be difficult to find the match. So let's break that down. Okay. So this is kind of a busy looking thing, but don't worry about it. So type A, and you can have a look in your textbook if you get kind of lost, contains B antibodies. So therefore, they'll destroy type B blood. So the antigen and the antibodies are going to be different, right? So type A blood has type A antigen, but it has type B antibodies. Sometimes it's kind of hard to grasp. It is, yeah, because an antigen is what causes the antibody. So if I have an antigen to sunflower pollen and I have that antigen in my system, I will create antibodies because the antigen. So that's why the A type is an antigen. But if you introduce B, if you cross-message this person with the wrong type of blood and you gave them a B, they would create antibodies. And what would happen after that is red cells would all clump together. You can actually kill somebody by mismatched, cross-matched blood. And that, sorry,
In my biology 12 online course, there was actually like this game you could play.
Oh, yeah.
You would transfuse them with the blood.
Right.
And if you did it wrong, it would make this awful noise and they would like kill somebody. Yeah. And oh my God.
oh,
So,
gotta kill them. Right?
cool.
Yeah, that's right. Yeah, that's kind of fun. And you'll notice if you ever have to have blood transfusion of any kind, they will always take your blood and cross-match it before they transfuse you, even though you were to tell them, oh, I may be positive. They're not going to go with that. They're going to cross-match you and check. Because giving the wrong type of blood is so devastating that they can't. So again, it continues on with B. Antigen contains A antibodies. Therefore, it will destroy type A blood. And they can only use B or O, which is the universal donor, to transfuse. So the universal donor, and I just want again to kind of bring your attention to this, universal, the donor part, because AB is a universal recipient, not a donor. The AB people can get any kind of blood, which is pretty awesome because there's only 4% of them. So it would be hard to cross-match these people. So it's kind of nice that they can take anything. They can use AB or O. Ah, see? That's perfect.
Blood of the movie.
That's right. So she is the universal donor. Thank you. Then actually, do they call you for your blood? You get phone calls? Because I know that there's some people out there who are type O negative that get called a lot. You might be type O positive, so that's why they have been calling you in. Okay. That kind of explains that, hopefully, and if you want to review it, just refer to your textbook. So transfusion reaction, or also called a cross reaction, I have not heard that term ever used. It's always a transfusion reaction. So the plasma antibody that you carry meets a specific surface antigen, and the blood will agglutinate, meaning form clumps, and hemolyze, which means it breaks open. The cells disintegrate. So when you're working, and LPNs cannot, at this time, cannot start IVs, but you're going to be trained to do that in the future. And I think this next class coming up at Shaw is going to be trained to start IVs. You can, yeah.
Starting IVs is a task, right?
It's a task that you learn. It's an educated task. It doesn't really require an RN or a doctor. You get your INAs, the guys on ambulance who start these. So it's a task. So it's just a matter of practice. So LPNs will be taught how to do that. But you can monitor a blood transfusion now. But I mean monitor it. Once the RN has established the IV line, has monitored it for the first hour, the responsibility, then after that, you are quite capable of monitoring it. If you're going to have a reaction to blood, if there's some antibodies in that blood that are going to cause a reaction, they usually happen right away within the first 20 minutes. You'll get chills, fever, that type of thing happen to your patient. So that's why they've got the RN monitoring it for the first hour, and then the LPNs are monitored after that. It's kind of funny because one of our LPNs is an older LPN. She's been working for a few years. But when I told her the other day that she could monitor, like, no, we can't. It's a disadvantage to them that I'm teaching.
Yeah.
Oh, yes, you can. But yeah. So as the LPNs, your job is changing so much. So you're doing more and more and more that your guys are going to be having a lot more responsibility. Okay. So we're going to talk about the RH factor. And that was, like I said, the studies were done on rhesus monkeys, and that's how they came up with the RH. It's also called the D antigen. So you either have RH positive or RH negative. Again, RH antigen is present in the positive, RH antigen is not present in the negative. I'll let you write those notes. So the bottom part here about the RH negative blood. RH negative blood that's been exposed or sensitized to RH positive will develop the antibodies. And this is really important when it comes to babies, right? Our newborns.